an individual finds that they can no longer find prescription opioids, some folks are transitioning to heroin use.
Deaths from opioid overdoses are at an all-time high in Kent County. And while much of the focus has been on addicts, criminal drug dealers, and the pharmaceutical industry, more attention is being paid to the role that doctors and surgeons play.
24-hour News 8's Barton Dieters is here to show us what's being done to change the way medical care providers approach opioids as a way to deal with pain. Barton?
Well, Sue and Brian, no one likes pain, and doctors are in the business of relieving it. But opioid overdoses are killing one person about every 3 days in Kent County. Now doctors are looking at how they can do things differently. A study done by doctors at University of Michigan Health System, an affiliate of Metro Health in Wyoming, published a study in the Journal of American Medical Association about their efforts to reduce opioid use.
Probably the most common complication of any procedure in the United States is taking an opioid naive patient, someone who's not on opioids, and kind of leaving them as now a new chronic opioid user.
Transplant surgeon Michael Inglesby is a co-founder of a group of physicians who studied the issue.
Once you're kind of addicted to opioids, it's a really challenging for obviously families and the patient and for caregivers to manage. So our goal is to prevent that.
Ingleby says it is recognized that many illegal drug users start out as prescription users.
Dentists and surgeons, emergency room physicians are really critical to try to prevent that downward spiral for patients.
The U of M group saw the average prescription drop 66%, and the number of patients getting a prescription for non-opioid painkillers, such as acetaminophen or ibuprofen, more than doubled. And requests for opioid refills didn't increase, as some had feared. But opioids are still necessary for now, doctors say.
So I'm not saying patients shouldn't be given opioids, but we've given way too many. We've done a disservice to our patients.
Simply providing less access to opioids is not a solution to this epidemic.
Steve Alsam is the director of the RED Project in Grand Rapids, which provides education and treatment.
We're not always providing them with easily accessible, effective treatment options.
But that is changing, according to Congressman Fred Upton, who's been meeting with FDA officials.
Let's find something that kills the pain that's not addictive, and there's some real promise that we may get there. We may be closer than you think of actually seeing some new drugs.
Now, of course, patients also play a role, educating themselves about the dangers of opioid addiction and being realistic about how much pain is manageable is critical for them. In studio, Barton Dieters, 24-hour News 8.